Although 1 in 4 adults experience mental health challenges, many people don't receive the professional help that's often needed to overcome them. Seeking out help from a professional for mental health concerns can seem pretty frightening if you've never done it before. I remember when I first started experiencing mental health issues, I had a lot of anxiety about seeking professional help, so I didn't do it, and things just got worse. When I first saw a doctor, I was diagnosed with bipolar disorder, and since then I've regularly seen a mental health professional who's helped me on my recovery journey. In this short video, I'll give you some basic tips so you can feel more comfortable in getting the help and support you deserve. First, let's go over a couple of myths that often keep people from getting help. Myth 1. If I see a mental health professional, other people will know about it. False. All mental health professionals are held to strict confidentiality laws known as HIPAA. Because of these laws, your information can only be shared with someone if you give your written permission. Professionals can lose their licenses if they don't follow these laws. Myth 2. If I see a mental health professional, I'll be forced to take medication and go along with whatever treatment they choose. False. You are in charge of your treatment. You cannot be forced to take medication or take part in any treatment you do not agree with. Always remember, you decide which services you receive to help you with your recovery. Now you might be wondering what steps you need to take to get help. Of course, the first step is to make an appointment with a mental health professional or provider agency. Your first appointment will likely be with a social worker, psychologist, psychiatrist, or other clinician. It usually lasts about 1 to 2 hours. It's a time for the mental health professional to get to know you and your history so that together you can start to develop a plan for your treatment. It's important to be honest and share as much information as possible. This will help them provide the right diagnosis and recommendations for the best way to move forward. Before the visit, it can help to write down the issues that you are having. It might also help to take a supportive family member or friend with you to provide extra support and encouragement. They can wait in the lobby or go into the appointment with you. The friend or family member could also help you remember and process the information that's shared during your appointment. Your first visit will give the mental health professional the information needed to diagnose the challenges you are facing. Examples of mental health diagnosis may be bipolar, schizophrenia, depression, anxiety. Your diagnosis will be used to identify treatments that have helped other people deal with similar challenges. My diagnosis is bipolar with co-occurring substance use, but I'm not my diagnosis, and neither are you. When leaving the first visit, the mental health professional should ask to make a follow-up appointment with you. If this is not done, make sure to ask what the next steps are and when you should expect to hear back from them. Be sure to get a contact number in case you have follow-up questions. Remember that it sometimes takes more than one visit to become comfortable talking to your mental health professional. But if you don't feel like the person you're seeing is a good fit for you, it is your right to find somebody else. Although getting help from a professional plays an important role in the treatment process, recovering from mental health challenges is not just about formal treatment. It's important for you to be the driving force of your treatment. Educate yourself about your diagnosis as much as possible and seek out others who have had similar experiences to help you. There are also many different local and national organizations, support groups, and online resources that can serve as an important role in your recovery. I hope this helps a little bit to get you started on your road to recovery and wellness.